let's get into a little bit of the COVID-19 stuff to start the discussion. And I thought we'd talk a little bit about the regulatory lay of the land, some breaking news that we just heard about yesterday, and what that might mean in some of the states around the country, and how the safety agencies may be enforcing COVID-19 issues, and then some of the kind of more frequently asked questions that we're dealing with on that front: record keeping and reporting, what is an exposure control plan and why do we need one, and then talk about some enforcement issues. And then we'll get into, in the second half of the program, what I call the prepare for and manage OSHA inspection discussion. I'm talking about the different stages, opening conferences, employee and manager interviews, and issues like that. The context here for how OSHA and the state OSHA plans will regulate this novel hazard, right? It's the novel coronavirus. There's not an existing regulation out there for how to address and mitigate exposures to this unique hazard in the workplace. So from the Fed OSHA perspective, the principal regulatory requirement, or the principal enforcement mechanism that OSHA will use to enforce COVID-19 issues, is the general duty clause. And those of you that deal even a little bit in the OSHA universe understand that there is this catch-all provision in the OSHA Act, Section 5A1, that requires employers to provide their employees a place of employment that is free of recognized serious hazards. And that is the catch-all provision where they have not promulgated a specific standard. We've seen it used a lot in the recent past for enforcing issues like heat illness, which would be an issue in the construction industry. Certainly, there's not a specific standard, but OSHA can go out there and say, look, this is a recognized hazard. We all understand that heat stress, heat stroke, heat illness exists. We understand the circumstances where it may, occur, and we understand at this point, enough science, enough medical research has been done to understand what can be done effectively to mitigate against that hazard. So if you are an employer and you are not taking steps, even though there's not a specific regulatory requirement, you're not taking steps to address the hazard, then you can be cited under the general duty clause for not taking recognized, generally accepted remediation type steps or remedial measures to address the hazard. Well, that's how OSHA is going to enforce issues, principally how they're going to enforce issues involving COVID-19. It's new, but at this point, I think it's fairly well recognized that it is a serious health hazard, and that it is, its presence is ubiquitous. It's everywhere, which means it's also in the workplace, or has great potential to be in the workplace. So it's a recognized serious hazard. Then the other things that OSHA needs to look for to prove a general duty clause violation are that there are recognized steps, abatement measures that would address the hazard. And what are those recognized measures? Generally, the way OSHA cites general duty clause violations, and the way we expect they'll do it, in this context, is they'll look to guidance that's been issued by a variety of different sources, whether it's, in these circumstances, the CDC, industry trade groups, the World Health Organization, any sort of standard setting organization that issues guidance, though they're not mandatory guidance, can become a source or a resource for OSHA to reference to either establish that a hazard is recognized or to establish that there are feasible means to abate the hazard. And one of the final or sort of most common sources of guidance that OSHA will point to for those purposes are guidance that the agency itself has issued. And this is, I think, a fairly controversial way that OSHA regulates. Rulemaking process is hard. It takes a long time, sometimes, even decades for OSHA to promulgate a new rule. So they have lately been issuing guidance, non-mandatory guidance, and then referencing it in general duty clause violations. You see that in the workplace violence context and heat illness and things like that. Rather than taking the hard route of promulgating a rule, they just issue guidance and then enforce it as though it is a rule. So I think we can fully expect that is how OSHA is going to operate in this context, and they have issued a ton of guidance. They're taking a lot of criticism for that, but it is, I think, a pretty appropriate way to handle a novel hazard like this but now they're going to be using what is probably at this point over 20 examples of industry-specific guidance. There's one about construction in particular, and other sort of broader pieces of guidance that apply to all workplaces, the returning to work guidance, the preparing your workplace guidance, and then all of this industry-specific guidance. So that's the framework that OSHA is going to largely be enforcing COVID-19 issues. I think we can expect to see a smattering of other citations out there for things like record keeping and reporting. We'll talk about that specifically in a little bit. Issues like hazard communication, right? A lot of employers are introducing new chemicals into the workplace, like decontaminants and sanitation chemicals to clean common surfaces and tools and things like that. Remember that when you introduce a new chemical into your workplace or a new chemical hazard into the workplace, that the hazard communication standard kicks in, and you've got to make sure you've got an SDS for the chemical, that the material is labeled correctly. If you take it from a big container into small squirt bottles, that you've got proper labels on the smaller bottles, and that you're providing training on those hazard categories. So HazCom, respiratory protection issues, probably not going to be too significant in the construction industry, but we'll talk about where that might come up as well. But by and large, it's going to be this general duty clause that's going to be the landscape that we're dealing with. That is not the case now in the state or the Commonwealth of Virginia. As of yesterday, making it hard to prepare for any presentation, the rules and the guidance are changing on a daily basis. But yesterday, Virginia promulgated the nation's first workplace COVID-19 specific infection prevention regulation. They issued an emergency temporary standard. It is not effective yet. It will be effective as soon as it is published in the Richmond Times Dispatch, or whatever the major newspaper is in Richmond. Once it is published, it will become effective. They've indicated that's likely to happen in about 10 days, the week of July 27th. What this standard does is it's what's called a program standard or a programmatic standard. It does not include a bunch of very specific requirements. It's not like your guardrail must be 36 inches high with a mid rail that is 12 inches below the top rail, that sort of specification. It's kind of generic. And what it does is it requires all employers to assess and categorize the potential exposures to COVID-19 in their workplace. And then based on that categorization, and it's from lower risk exposure, medium, high, and very high, based on whatever category you fall into, there's a series of requirements or types of requirements that you would be required to adopt in your workplace. And the very high and high categories are basically going to be your healthcare industry, healthcare, death care, emergency responders, prison systems, correctional facilities, things like that. So not our construction facilities or construction operations. The medium category, and I should be clear that these categories are not sort of generic umbrellas for an entire workplace. They're actually tied to different tasks in a workplace. So you might have some tasks that are in the medium category and others that are in the lower. And we analyzed this question from Wendy earlier this year as everybody was trying to get the lay of the land for COVID-19. Where does construction fit in to this categorization, which actually OSHA and the CDC first put out there to the public in a big guidance document, OSHA's initial preparing the workplace for COVID-19. And the basic distinction between medium and lower is exactly what you would expect. How much exposure does the employee performing those tasks have to the general public or to coworkers? How difficult is it to ensure social distancing based on the task that's being performed? And our analysis determined that largely construction, outdoor construction, home building, like you all are engaged in, will mostly be in the lower risk category, but there may be some tasks where multiple employees are required to be in a single room, a common room, as the home is getting close to being completed. Walls are erected, you're no longer outdoors, and multiple employees are required to be in the same room, or they're required to pass each other closely in common areas within the structure, that tasks like that, and tasks perhaps that require more than one employee to perform at the same time, that some of those might fall into that medium risk category. And the significance of that by this rule in Virginia, and this rule in Virginia, incidentally, we're viewing as, maybe a precursor or foreshadowing for what numerous other states are likely to do, and perhaps what Fed OSHA may do under different circumstances. And we'll talk a little bit about that in a second. But if you're in the medium category, there's a fairly significant burdens on the employer to adopt all sorts of protocols and requirements for dealing with COVID-19 in the workplace, including training employees on the hazards, training employees on the mitigation strategies to address the hazard in the workplace. But regardless, whether you're medium, as well as PPE requirements and things like that, but regardless of your categorization, medium or low, every employer in Virginia is going to have to adopt and implement a written infection control plan, what we've been calling an exposure control and response plan. And the bullets here identify the major elements of what VOSH is going to expect to see in an exposure control plan in Virginia. And that is to implement policies to identify and remove known or suspected COVID-19 infected employees from the workplace, as well as policies for when it is safe for an employee who has had the illness to return to work. Obviously mandating social distancing measures with signage, as well as possibly reconfiguring the workplace, policies, training, and requirements to keep employees 6 feet apart to the extent possible. Requiring masks. Virginia has, for a while now, actually had a mandatory mask policy for anybody in the public, and certainly in workplaces. That's going to be an element of every exposure control plan that VOSH expects to be developed under this new rule. Providing the tools for, and the time for, and the requirement to conduct frequent hand washing and hand sanitizing. Adopting robust sanitation procedures, including the, identifying and using proper EPA approved cleaning chemicals that actually kill the coronavirus, and setting a procedure, whether it's specific frequencies or specific occurrences that would trigger cleaning of common areas, of common tools, of surfaces where the virus may be present. And this not particularly applicable to construction sites, but in many workplaces, it will be evaluating HVAC systems to improve air movement and to improve air purification within indoor workplaces as an engineering control to address the virus. And
Eric, are there standards for that? What, for example, in office space, what kind of air conditioning are they expecting?
Yeah, it's a great question. So there's a lot of guidance out there that's real squishy, right? It doesn't identify a specific, frequency or how many times the air needs to be turned over within an hour to be satisfactory. The concept is look at your existing HVAC system and see if there is a way to enhance it, to move air more quickly, to enhance it with air, even standalone air purification systems. But there's not, that I've seen, anything in the way of a specific data on how many AFMs, how many how often the air needs to be turned over. It's more about if there's opportunities to improve it, look for those opportunities, and that's what we've seen from CDC and OSHA up to this point. Certainly not in the VOSH standard, or any standard that I would expect to see is it going to get to that level of detail. One new element, though, that I've not seen anywhere else, either in guidance from OSHA, CDC, or anybody else, is a requirement that if an employer learns that one of their employees is positive, COVID positive, that there is a requirement that within 24 hours, all employees are notified that one of their coworkers tested positive. Keep in mind that when you are dealing with these notifications, there is a confidentiality requirement under the Americans with Disabilities Act and the EEOC, notify employees that they may have been exposed, they may have had close contact, that an employee in the workplace has tested positive, including a contractor or a subcontractor has tested positive, but try to do so in a way that maintains the confidentiality of the employee. That's going to be, difficult. It will probably be obvious in many circumstances on a relatively small construction site who that employee is, but your duty is to just, maintain the confidentiality the best you can. If people figure it out, so be it. But this is an interesting new requirement here that notification has to be within 24 hours, which I just haven't seen anywhere else. What's interesting about this emergency temporary standard, it's the first in the nation, and it comes after and really in response to and because of FedOSHA's refusal to adopt such a standard. And I think FedOSHA is exactly right that a specific standard like this is not necessary and is largely unworkable. The guidance changes every day. The idea that you're going to set in stone a standard that is very hard to adopt and change, I think is unworkable. And regardless, whatever the standard is, we're seeing exactly what Virginia is doing. It's really pretty generic, right? Do an assessment and then implement policies that touch on these general topics. That's hardly different than guidance enforced under the general duty clause. Nevertheless, it's become obviously highly political. The AFL-CIO sued federal OSHA to force them to promulgate a rule. OSHA defended itself vigorously that a rule is not necessary and prevailed in federal court. And so it will not be adopting a standard like this, I don't think, unless one of two things happen. One, Congress can mandate that OSHA adopt certain standards. They've done it before. And the House of Representatives has, in multiple rules that have moved through the House, created such a requirement that within X months, generally 6 months, the FedOSHA must adopt an emergency temporary infection control standard. That has not been taken up by the Senate yet. It is possible that there is some deal brokered for immunity or additional funding of some of these PPP type programs, loan programs, or things like that, that there is some horse trading that results in a congressional mandate to OSHA to do this. So that's one scenario. The other scenario is if Joe Biden wins the next presidential election and he steps into office in January of next year and the pandemic is still very much with us, then we could see OSHA under a Biden administration adopt this rule. Unless or until either of those things happen, I just don't see FedOSHA doing it. But regardless, all of the elements of this rule are already part of FedOSHA's guidance that they're going to be enforcing under the general duty clause. We do expect, however, and this is already happening, I mentioned sort of at the beginning of our call, that other states are moving forward, just as Virginia has, to adopt their own version of this kind of rule. Oregon OSHA is writing a standard right now. Cal OSHA is fielding a petition from WorkSafe, a worker advocacy group out in California. And I was just on a call with the Cal OSHA Standards Board right before our discussion today, where they are about to vote on that petition as to whether the agency will adopt an emergency temporary standard. If you know much about Cal OSHA and California generally, I think it is a fairly safe bet that they will vote to adopt that petition and that they will adopt an emergency temporary standard. I wouldn't be surprised to see that happen even by the end of July. So I think what's happened here in Virginia is a precursor for what may happen all around the country, or at least in a bunch of different state plans around the country. And then ultimately FedOSHA could be forced to come along as well. But regardless of whether it is a specific standard like Virginia's emergency temporary standard or the general duty clause, I think the steps that employers should be taking are generally speaking the same. And they are, and that first thing, whether you're required to do it because Virginia passes a rule or it's just a recommendation and guidance from others, a number one step that I think every employer should do is develop and implement a written, comprehensive COVID-19 exposure control and response plan. And what we were seeing, early in the pandemic and really still today with employers that we work with as they are reopening and returning to work in greater force, is that employers are grabbing, the guidance that's coming out from CDC and OSHA, and they're adopting individual policies, and they're making physical changes in the workplace, and they are providing training and communications and all that good stuff. But it's all sort of floating around out there with an individual policy here, written communication there, and it's not been pulled together in a common plan. And so a lot of what I'm talking about here may just be, getting a stapler and grabbing all of your individual things and pulling them together. But I think it's really important to do that. I mean, I think doing it in a more formal and thoughtful way is great, but it may be that it's just a matter of organizing and pulling everything together physically. There are three reasons why I think that's really important. The first reason is your employees are anxious, right? Employees around the country are scared about whether they can work safely, whether they can go to work and be safe from exposure to this hazard. We have seen, it is really extraordinary, over the first few months of this pandemic, between federal OSHA and the state OSHA plans, something in the range of 30,000 employee complaints about COVID-19 have been filed with OSHA and the state OSHA plans. Employees are concerned about access to PPE and other protective equipment. They're concerned that their employees are not enforcing social distancing or mandating breaking down social distancing, that they're not taking enough steps to reconfigure the workplace, that they're not implementing smart policies, or that they just have no idea what their employers are doing. And that has two effects. One is there are a lot of employees out there who are refusing to work, refusing to come to work. And then you face potential retaliation claims. If you declare that the employee has abandoned their job and take adverse employment action, they could bring an action with OSHA or other agencies saying that you've retaliated against them for raising safety concerns. I don't think that unless you are really flouting the guidance that's out there, that there is going to be a lot of successful retaliation claims, but you're going to see them and you're going to have to deal with them. And then the flip side of that is what I mentioned already, complaints to OSHA. And if a complaint is made to OSHA, then you're going to have to deal with OSHA. It's going to be either a response to one of those notices of alleged hazard where you write a letter to the agency explaining why the complaint's not valid and explaining what you're doing to address the hazard. Well, that may open the door to an inspection, and it's going to take some time and burden to respond to that. Or, worse yet, OSHA says, I'm very concerned about this employee complaint. I'm going to open an inspection. And that's happening now. For a while in this pandemic, OSHA was largely focused on compliance assistance and education, but after getting beat up in the press a little bit for appearing to be sitting on the sidelines, they've opened a ton of inspections. There's over 700 enforcement inspections that have been opened about COVID-19 really just in the last 45 days. So the employee complaint is a problem. You want to avoid that. And we found that maybe the most effective way to avoid the employee refusing to work and the employee complaining to OSHA is to have a really good, thoughtful written exposure control plan that you can put in your employees' hands. They can see it, they can feel it, they can recognize that you have put a lot of thought into this and you care and that you are engaged in managing infection control at your workplace. And so, that plan will hopefully ease some of the anxiety of the employee, which will protect you from having to deal with the agency, hopefully. Second reason why it's important to have it is there is going to be some inevitable interaction with OSHA about this pandemic. And having the exposure control plan is going to be your exhibit A when you get that notice of alleged hazard, or you have an inspection that starts and you get the subpoena or document request for your exposure control strategies, that you've got a nice, clean, tidy package in one place that you can deliver to OSHA and say, here's what we're doing. They're going to be very impressed with that, and they're probably going to walk on to the next workplace to find somebody who's not paying attention to the hazard. So really helpful in that regard. And then the third reason why I think it's important to have is I think there is probably a tidal wave of civil litigation waiting around the corner for employers about COVID-19. Wrongful death suits, public nuisance suits, workers' comp disputes, whatever it is, there's going to be a lot of complaints, a lot of claims made about infections, whether they occurred in the workplace, very difficult to prove. But if you find yourself in that battle, it's going to be really helpful to have, again, Exhibit A, look at our very thoughtful written exposure control plan that implements, all the best guidance, following everything that CDC and OSHA is recommending, and here we are. That's why your lawsuit should go no further. So a lot of really important reasons to do it. What is it? What's in it? It's basically everything. It's everything that you have done already to adopt CDC and OSHA recommendations about infection control. It is a hazard assessment to determine where exposures might be most likely in your workplace. It's a PPE hazard assessment about this unique hazard. Do we need, respiratory protection? Do we need gowns, gloves, things like that? Not so much for the virus itself, other than protective. Cloth masks and paper masks and face coverings and things like that, which are not actually PPE, but for your cleaning crew who are working with hazardous chemicals. Do they need gloves? Do they need respiratory protection? And what about if you're undertaking a pre-work health screening, like temperature taking, things like that? The employee who's doing that temperature taking, if it is an employee and it's being done on site, think about PPE that's necessary for those tasks. Signage and communication to employees about individual personal hygiene, about social distancing, things like that. That's all going to be part of your exposure control plan. What are the policies that you're going to implement to identify potentially exposed or actually exposed and infected employees and keeping them out of the workplace? That's going to be things like your pre-work health screening that we talked about. It's going to be things like perhaps a sick leave policy where you are requiring employees to notify you if they're experiencing symptoms or if they've had an exposure, and perhaps providing some paid sick leave or other protected leave while they quarantine because of that exposure. Maybe travel restrictions, things like that, or commuting restrictions, no carpooling type restrictions. Those kinds of policies would be part of your exposure control plan. Implementing policies and procedures that would limit the number of workers at the workplace at the same time, staggering start and end times. That's one of the big challenges on a construction site, is tons of people showing up and leaving at the same time, going through common areas at the same time. Think about ways to maybe stagger start and end times of shifts and break times of shifts so people aren't gathering in common areas at the same time. And then to the extent possible, just limiting the size of crews, limiting the number of employees present at any one time. And teleworking as much as possible. I know that's not possible for somebody who's putting a nail into wood, but for those that can work remotely, require that wherever it's feasible. Providing tools and supplies for individual personal hygiene. The alcohol-based hand sanitizer. This is a challenge often on construction sites, but making sure you have hand washing stations and water and supplies for hand washing, adequate supplies of that, and then setting as a policy and an expectation that that's going to be done regularly and frequently by your employees. Enhancing a sanitation program, how often you're cleaning common areas, how often you're cleaning common surfaces, tools that might be shared by multiple employees, and to the extent you can, limiting the sharing of tools or eliminating that if at all possible entirely. We know that's not possible for some things like powered industrial trucks, forklifts, earth moving equipment, things like that. So if that's going to be used by more than one employee, making sure that that's part of your sanitation program between uses. And then implementing any other engineering or administrative controls that you may be able to identify to control the risk of exposure. And some of those include, we talked a little bit already about the air filters and air filtration, maybe physical barriers that might be appropriate, like sneeze guards, or maybe even wooden barriers to keep employees who have to work in a common area separated by a physical barrier. The administrative controls, I think we talked about all of these already. One thing though is you've probably a daily toolbox meeting or safety huddle or something like that before each day of work. You should certainly be continuing to have regular and frequent safety meetings and pre-shift meetings, but think about ways to do that safely, either by a virtual means or at least by ensuring social distancing to the extent possible for those meetings. We've talked about the rest of this already. So let's talk now about some other elements of the written exposure control plan. We've talked about this. It's basically a program, like your lockout tagout program or your HAZCOM program. It's the overarching sort of umbrella document that explains everything you're doing, and then includes a bunch of individual specific procedures. It should be tailored at least to sort of category specific, if not site specific. If you've got very common workplaces, which you do as you're building, communities with very similar sites, you might be able to take something that applies to multiple sites, but as site specific as possible would be useful. Let's see, social distancing. Yeah, we've heard all about this from guidance, from TV, everywhere you look. Everyone's talking about social distancing. Think about ways to help clarify what is safe distancing for your employees. I mean, you see this in indoor workplaces where you see these sort of stickers or placards on the ground that show what is 6 feet apart, and in common areas where people might be clocking in, or workstations that identify what is 6 feet apart. That's very useful. We use, I say, hall monitors here, like you'd see in elementary school. But basically, think about an employee whose responsibility it is, and it could be among other responsibilities, but who is looking out for breakdowns in social distancing and reminding people to maintain social distancing. That's a function that is assigned to someone or several people at the site to remind others about that requirement. We talked about staggering and rotating start and end times and break times to maximize the ability to social distance, and reconfiguring workplaces if possible to do that. Pre-shift health screening is something that we've gotten a ton of questions about, and we've helped employers develop some protocols around this. This is something that historically, until a few months ago, would have been absolutely prohibited. The Americans with Disabilities Act and the EEOC say you absolutely cannot perform medical evaluations, make it a condition of employment to participate in certain medical evaluations, or to ask employees about their health status. But because this COVID-19 is a direct threat in the workplace, infected employees are a direct threat to the workplace in this scenario, and until that is lifted, you are allowed to conduct this kind of screening and ask those kinds of questions. And it is, part of a lot of guidance out there. It's recommended. It's going to be part of, I'm sure, some of these specific standards that are being promulgated in different states. There's a lot of different ways to do this. I think if you have a good paid sick leave policy or other policies, maybe the flip side of that, really good discipline, that you could make this a do-it-yourself, do-it-at-home kind of requirement. If you could trust employees to be honest about it, where employees feel like they can't afford to miss work, maybe they won't be honest about it, in which case you've got to do the screening yourself at the workplace. But if you can trust that you're going to get honest answers about it, then I find the best way to do this is to require it to be done by the employee at home, even before coming to the workplace. And if you can, we've recommended to some of our employers to supply all their employees with an oral thermometer. They get their own, they take it home with them, do the screening, and report to us before you come to work that you're in the safe zone from a body temperature standpoint. If you are going to do it at work, give some thought to how, where, and who is going to perform that. I found that the most effective way to do it, if possible, at the workplace is before the employee even gets out of their car, right? Drive by a guard gate, a tent, or something like that in the parking lot at the workplace. Have the employee crack the window by an inch or two, and then have an employee who's protected with PPE, gloves, face shield, gown, and a non-contact thermometer, who's also protected by the window itself, like a sneeze guard, to take the body temperature of the employee. And that way, an employee who happens to be sick, who's infected, who has a fever, doesn't enter the workplace at all. And it's a nice controlled way to do that with an additional safety measure. So think about that. If you are performing this screening, if you go out there and hire a medical professional, a nurse or a nurse practitioner or anybody in that medical field to perform this task for you, you may be creating records that have to be kept for decades. If you write down the body temperature and the person that makes that record is a medical professional, that is a record that's going to be covered by OSHA's 1910-1020 employee medical record standard, which has to be kept for the life of employment plus 30 years. So one of the things we're recommending is don't use a medical professional, use an employee who you train in some safety protocols to do the measuring. And second, and more importantly, don't write down the temperature. You don't need the actual temperature. We're not doing modeling or trending or anything like that. You're just looking for a yes, no. Can the employee enter the workplace or not? So if you're going to keep any kind of written log at all, check X, enter, do not enter, safe, unsafe, whatever it is. Anything other than the actual body temperature would be the way to approach that. And if you are writing that down, even if it's not a medical professional, you do have to keep it for at least 1 year under the ADA. So another reason not to write down body temperatures at all if you can avoid it. Sanitizing and disinfecting, we already talked about this a little bit. There is a list EPA has provided of effective chemicals to actually kill the active virus. So make sure that you're using a proper chemical for that cleaning and that you have developed a protocol for how often you're going to clean, where you're going to clean, that you've identified those high touch point areas, those common tools, those common areas, common equipment, and that you're cleaning it on a regular basis. And you've got to sort of do your own analysis about what would be an effective frequency for that. And that depends largely on how much traffic is in that location, how often are multiple employees or different employees using certain tools and equipment. And I think if you've got a piece of equipment like a powered industrial truck, earth moving type of equipment, that's something that I think needs to be cleaned and disinfected between each use, between each different user. And I think OSHA would expect that as well. And we've seen some recommendations in that regard. And one other, the final bullet on this list, on this slide, talks about disinfecting and cleaning in particular, but this is really good advice generally for everything we're talking about, is check for state and local guidance. The reality is that our work as employers and employer representatives is really, really difficult in this context because you've got, county health departments issuing guidance and orders. You've got governors issuing executive orders and guidance. You've got CDC and OSHA, and now some of these state OSHA programs issuing their own standards. There is an extraordinary patchwork of guidance and requirements that is out there, and you really need to understand what might apply to your workplace. Are there specific county, locality, state requirements that apply beyond what OSHA and CDC have been issuing, and make sure that you're adopting and addressing those. True for disinfecting and cleaning, true for face coverings, true for pre-shift health screenings, etc. Just understand what may be applicable to your workplace. Face coverings has become, regrettably and almost inexplicably, a very controversial issue in this country. It's become a political issue, which is very frustrating for safety professionals, I'm sure. There is pretty good science right now, right? It's still a novel virus and a new issue, but pretty good science to show that face coverings, even loose-fitting cloth and paper face coverings, are pretty effective at reducing transmission from an unwitting wearer of the mask to other people. And the reason why, I guess, if you're looking for sort of the explanations for why it's so controversial, is there's also pretty good science that shows that these kinds of masks are not super effective at protecting the wearer from contracting the illness. But that's not why everyone is recommending that you require wearing of the masks and that you wear the masks. It's that the wearer, who may not realize they're infected, is a spreader, is contagious or can be contagious, even if they are pre-symptomatic. And so that person wearing a mask is very effective to protect everyone around that person. And the concept of mandating these masks in the workplace is, my mask protects you, your mask protects me. We are at the point now, and again, there's no specific standard. We're talking about the general duty clause. I think that we are at a point of consensus from regulators, from CDC, from OSHA, from basically every bit of guidance that you see out there from the scientific community supports the requirement for masks whenever social distancing cannot be assured. I think we are at the point that it is essentially a general duty clause requirement to provide masks in the workplace, to provide and require and enforce the use of face coverings in the workplace. I think if you have an extraordinary overall program with one piece missing in its face coverings, you might be able to defend against a general duty clause violation, but I think it is going to be seen by OSHA as feasible, pretty simple actually, feasible means of abatement for a recognized serious hazard. And I think on its own, not requiring masks or not enforcing a mask requirement could be enough to support violations. I wouldn't be surprised to see those issues. So that's my personal opinion, understanding how OSHA operates, reading the tea leaves and reading the guidance that's out there. I think this is a regulatory requirement at this point, that unless you are in an office, closed door, truly separate workspaces, or in an outdoor workspace where there is no chance of someone breaking down that 6-foot social distance barrier, that masks are required. They are, however, not PPE. They are not personal protective equipment because they are not totally effective at protecting the wearer of the mask, which means sort of you're not required to pay for it. It means sort of you're not required to provide training on it. What it means when I say sort of is you can't be cited under OSHA's PPE standard for those things. But I do think if you are not explaining the limitations of the mask, when it should be worn, how to store it if you're going to be reusing it, how to clean it, those sort of things, I think there is potential violations under 5A1, but it is not covered by OSHA's PPE standard, which triggers a lot of those kinds of requirements. So it's our recommendation that this is part of your exposure control program. The other side of this coin is respirators and respiratory protection. These are not respirators. They're not covered by 132, the PPE standard. They're also not respirators covered by the 134 standards, unless you are requiring or permitting voluntary use of N95 masks. N95s actually are respirators, or they're considered to be respirators by OSHA, and those trigger all kinds of other requirements. One of the things that, if this is an issue y'all are dealing with, we can talk about it, offline. I don't want to get down and, mired in this mess, but there's a lot of issues with availability of respiratory protection right now. So if you have tasks like certain welding tasks that require the use of respiratory protection, there's all kinds of guidance out there right now about how to deal with the shortage of N95 masks. We can talk about how to deal with that if that's an issue that you guys are dealing with on any kind of regular basis. The last thing that I want to talk about that I think is going to be part of your exposure control plan, or should be, is how you respond to confirmed cases. And that's responding to it in the immediate, how you isolate and remove the employee from the workplace, and what your policy is going to be, how long they're out, and issues like that. How you're going to communicate the news of the positive employee to other coworkers, what you're going to do at the workplace when there is a confirmed case, right? Are you going to shut down the workplace for some period of time, perform deep cleaning and sanitation, or shut down part of the workplace? Think about that in advance, and what makes the most sense based on your circumstances and based on the guidance that's out there. And then the sort of longer term, how to deal with confirmed cases is, when is it okay for an employee to return to work? And there's pretty good specific guidance out there from CDC and OSHA on that now. There's 2 different ways that you can evaluate when it's safe for someone to return to work. It could be a negative test, or really what the guidance is 2 negative tests over 2 different days with 2 different respiratory specimens, or a time-based protocol based on timing from initial symptoms, timing from the last known experience of symptoms without the aid of a fever-reducing drug or cough suppressant or things like that. So think about that in advance, build that into your exposure control plan. So that's just a long way of saying exposure control plan is my 1st, 2nd, 3rd, and 4th most important recommendation for how to deal with this pandemic in the workplace. Last couple things I want to talk about in the context of COVID-19 in the workplace is record keeping and reporting. This has been a pretty controversial and an issue that unfortunately is requiring a lot of people's time when I think it is worthless and not the right issue for safety and health professionals to be focused on during this pandemic, but alas, that is where we are. OSHA has in its injury and illness record keeping and reporting requirements an exemption for the cold and flu. And the reason why those particular illnesses are exempt from record keeping requirements is that they're ubiquitous. Exposures are everywhere and they're invisible, and it is nearly impossible to identify whether someone's cold or flu illness was contracted at work, was contracted on the bus on the way to work, was contracted at home from one of your kids, was contracted at the grocery store, et cetera, et cetera. Because it is nearly impossible to identify work-relatedness, OSHA, when it promulgated its record-keeping rule, exempted the cold and flu. When COVID-19 reached our shores, we started campaigning to Fed OSHA, and all of our brothers and sisters of the OSHA bar were campaigning to OSHA to exempt COVID-19 because it was going to act and operate exactly like cold and flu in terms of figuring out whether it's work-related. And OSHA acknowledged that, agreed with that, and understood that, and basically said, we wish we could exempt it. We would if we could, but we can't. And they say that because the cold and flu exemption is not a policy. It is a regulatory, it's in the regulation itself. It went through APA notice and comment rulemaking, and COVID-19, as similar as it may act to the cold and flu in a lot of different ways, it's a different virus. So OSHA can't just wave a magic wand and say, it is the cold and flu and it's exempt. So what they did instead was to issue some guidance that made it almost exempt. They made it very difficult for a case to be found to be work-related and recorded. So here's the three basic requirements: to be recorded or to potentially have to pick up the phone and call OSHA about an employee a COVID-19 case. The case has to be a confirmed case of COVID-19. That means at least one respiratory specimen tested positive in a laboratory for the active virus. Not a subjective medical diagnosis, certainly not a self-diagnosis. It has to be a lab-based test to be recorded. Second, it has to meet the recording criteria, which means including days away from work, which is going to be the case essentially in every instance. If someone tests positive, they're going to be quarantining even if they're asymptomatic. But the third one, the big one, I mean, the first one's pretty big too. Confirmed case is relevant in a lot of these analyses that we do. But the third one is the biggest one, is determining that the case is work-related. And OSHA set out some guidance on how to figure out whether a COVID case is work-related. It has to be more likely than not that an exposure in the workplace was the exposure that caused the illness. And they say employers, although you do have to do a case-by-case analysis, employers are not expected to undertake an extensive medical inquiry. They can look for situations that are more likely than not to be work-related if they involved a cluster of cases, numerous cases in the same workplace among employees working with close contact with each other, and there's no alternative non-work explanation. Or an employee becomes sick shortly after working in close contact with a single employee who was later confirmed to be positive, and there's no alternative non-work explanation, or the job duties involve frequent exposure to the general public in a community where there's ongoing spread, and there's no alternative non-work explanation. The reality is you've got to try pretty hard to not find an alternative non-work explanation for how an employee could have contracted the illness. I have helped employers evaluate hundreds and hundreds of cases now of employees who have happened to have tested positive to the illness. We have found work-relatedness on only a few, very, very few instances. One involved an employee working on an offshore drilling well who was present and living on that offshore platform for the entire incubation period. So it was really hard to find a non-work explanation in that case. And another involved an employee who somewhat credibly described a pretty hermetic lifestyle. The employee drove himself to and from work, didn't carpool, didn't take public transportation, and basically said, all I do is work. They work for a large national grocery chain. The employee's wife was home pregnant, and so the employee's family was keeping very much self-isolated. This employee went to work, got the groceries for the family while at work, and otherwise claims to have not done anything that would involve social interaction. It was relatively believable, and so we couldn't find an alternative work explanation. But every other circumstance, we've got an extensive questionnaire that we'll find. Did you go to a 4th of July barbecue? Are you taking public transportation to work? Do you have teenage kids that are out socializing and potentially bringing things back into the workplace? Do you have someone living in your house who's also out working in workplaces where there's potential exposures and who's tested positive? It is generally pretty easy to find that alternative non-work explanation. So it's going to be very hard, I think, to find recordable cases. I think it's going to be even harder to find cases that have to be reported to OSHA, where you pick up the phone and call them. The reason is you've got the same analysis for confirmed case, same analysis for work-relatedness, and then the only circumstances you have to report to OSHA are an employee fatality and a hospitalization. But for a hospitalization to be reported to OSHA or reportable to OSHA, the employee has to be admitted to the inpatient service of a hospital within 24 hours of the exposure, and now work-related exposure, right? The exposure that caused the illness. And that's just not how COVID-19 works. It generally takes at least two days for any symptoms to appear, and then several more days from there for the symptoms to become so extreme that the employee is admitted to the inpatient service. So I would be stunned if there is ever a legitimately reportable hospitalization, COVID-19 hospitalization. There is more likely to be reportable COVID-19 fatalities. Those have to be reported if the death occurs within 30 days of the work-related exposure. There are plenty of cases we're hearing about where the employee succumbs to the illness more than 30 days after the exposure, but also plenty that are occurring within 30 days. So if you get to work-relatedness and an employee succumbs to the illness within 30 days, you may have to report that circumstance to OSHA. I don't want to spend a whole lot of time on it, but I know we've got some California attorneys on the phone. Cal OSHA in COVID-19 and COVID-19 record keeping in particular has done what Cal OSHA does almost in every circumstance and gone beyond where Fed OSHA is and provided more stringent requirements. They have deviated from Fed OSHA in a couple of key ways. One is they are saying they don't care about confirmed case. They don't need a lab test for a case to be potentially recordable. And they have flipped the more likely than not work-relatedness standard on its head and established a presumption of work-relatedness if there's any identifiable workplace exposure. And they don't explain whether that is a rebuttable presumption, how you would rebut it, what level of non-work-related exposure is necessary to rebut the presumption. So that's an issue. So it is much more likely that you would have a recordable COVID case in California than anywhere else in the country. However, I think that is illegal. And that was the reason, actually, I was on the call with the Cal OSHA Standards Board before this meeting. I've put together a coalition that includes the California Chamber of Commerce and a bunch of national and California trade associations to press Cal OSHA to realign its record-keeping requirements with Fed OSHA because the law requires it. Fed OSHA's regulations dictate that state plans must have the same requirements as Fed OSHA for determining which injuries and illnesses are recordable and how they're recorded. The law allows state plans to be more stringent than Fed OSHA in 99.9% of circumstances. They can set permissible exposure levels lower. They can set, shorter time periods to report things. They can create unique standards like heat illness standards out in California that Fed OSHA doesn't have. But the one thing they cannot do is set a record keeping requirement that differs from Fed OSHA's. And so we've been working with this coalition to try and get Cal OSHA to rescind that guidance that sets the presumption of work-relatedness and doesn't require a confirmed case. But for now, Cal OSHA's expectations are those things are going to be recorded. Reporting is also very different in California, and it's allowed to be, unfortunately. For a case to be reportable in California, it has to either be work-related, based on California's guidance that it's presumptively work-related and doesn't require a confirmed case, or it can be an instance where the employee, where the illness occurs in a place of employment, even if it is not work-related, meaning we know that it is caused by, a family member at home that tested positive a couple days before me, and I haven't even been at work for 14 days. But if I go to work and I start to experience symptoms of the illness while at work, that has occurred in the workplace, and I have to report that to Cal OSHA if it results in a hospitalization, a death, and so forth. So Cal OSHA is doing things differently as they are wont to do. And if you have any questions about any of the unique aspects of California, please let me know. We've got a great group out in California working on those issues. So that's the COVID-19 piece of the discussion. We've got a ton of resources on our website, a frequently asked questions page that I think is like a 50-page manuscript now. Check that out. We've also got some record keeping and reporting flow charts for COVID-19 in particular, a bunch of articles, a bunch of recorded webinars, things like that. So please check that out if you have any questions, or just reach out. I love to talk about this stuff. Before I jump into inspections, does anybody have any questions about the COVID-19 issues?
Yeah, Eric, this is Matt Gallington. I'm one of the safety guys. How are you today?
How do you do? Thank you.
Good. Thank you first and foremost for your time and information. It's refreshing. It's a lot of great things that we have been pushing from our small department, and so it's good to hear from someone with your experience that kind of support some of the things that we're doing. My question is this: are you finding that a lot of what we do in the field is geared around the subcontractors and the sub tiers, and sometimes our stance is they're not technically our employees, however we push them to the similar or same standards in most cases, just based on the multi-employer rules and regulations and things like that? Would you advise to continue that path? That they're on our side, we have ultimate oversight, and again, under that multi-employer, some states are more stringent than others, or I would say more diligent about enforcing that than others. And we always push for our due diligence and our reasonable care. But just kind of your thoughts on that. They're not technically our employees, but yet they have the ability to expose our employees. And so, some thoughts on that.
Yeah, I think that's exactly right. The general duty clause can be cited and applies in the multi-employer context, just like any other regulatory requirement. So I think OSHA will look at it that way for general contractors and construction managers, that as the controlling employer on a work site, you have a responsibility to either implement some of these policies and procedures or physical changes yourself, or to ensure that that your subcontractors are doing so. And we see this, obviously in the context of fall protection, in the context of trenching and excavation issues, that the controlling employer is on the hook for likely a copycat citation to what one of the subcontractors might see if a subcontractor is not providing these levels of protection for their workers. And I would view this the same way, right? Think about the face covering requirements. View that almost the same way as a hard hat requirement. It's not PPE, but it is essentially a protective equipment requirement that while you're not required to pay for and train the subcontractor employees in the requirement to wear a hard hat on site, you're certainly going to be potentially on the hook if OSHA shows up and sees that a bunch of subcontractor employees aren't wearing hard hats. They're going to say, are you out there doing, audits? Are you out there doing inspections? Are you out there enforcing the site safety requirements on subcontractors? And I think we're going to see a very similar approach from OSHA in this COVID-19 context. So, there's a couple different ways or a few different ways to handle that. One is you really take total ownership of that and enforce that, supply masks and supply, barriers and things like that. Set up a station to do the pre-work health screenings directly for employees and subcontractor employees as they come on site, or you set a requirement that your subcontractors do it, probably the easier way to do it, but you still implement some level of oversight over that, build it into your site safety inspection checklists and some of the other protocols you have to evaluate whether your subcontractors are meeting your expectations, are meeting OSHA and CDC expectations, and document the efforts you've made to evaluate and enforce those expectations on your subcontractors if you're not going to do it directly yourself. But I think it's always a tough environment for the controlling employer to manage employees who are not their own. And when it's a constantly changing and dynamic workplace and new crews and new employees and new subcontractors coming on all the time. But I do think that's exactly how FedOSHA is going to look at it, the same as they would any other requirement. So it's a great point and a great challenge that that we have as a controlling employer.
Well, I appreciate it very much. I'm gonna remember you use that term documented effort. The guys around the country are sick of that phrase from me, but that's exactly what we push is, you can't fix everything, but you can document you're trying. So I appreciate it.
Yeah, exactly. And I've seen some really good tools that you all have and some of the electronic site inspections and checklists and things like that. Those are going to be really useful. Try to incorporate a COVID-19 section into some of those checklists, and I think that'll be
in there. Yeah, first 4 questions now.
Yeah, very good.
Yep.
Let's jump into OSHA inspections. One of the things you'll see here right on this cover slide, this is something else. I should have included a link to this. We put together a toolkit, and this is the cover of the toolkit. That's about a 10-pager on tips and strategies for managing OSHA inspections. And it's sort of a written, kind of bullet list version of the presentation that I've got here. I definitely encourage everybody to check that out. That might be a useful tool for thinking about how you'd manage an OSHA inspection if OSHA showed up at one of your sites. But one of the things to think about, before you get into the stages of an inspection is to think about what you're trying to accomplish. What does it mean to manage an OSHA inspection? What are your goals for effectively managing an OSHA inspection? And the first bullet is really the most important. It's the one that kind of everything flows from that, and that is controlling the flow of information. And it's controlling the flow of information to OSHA. And the idea here is not about, sweeping things under the rug or hiding them from OSHA. It's about controlling when and in what light OSHA sees and understands your safety programs and policies that are in place at the workplace. And to some extent, narrowing the scope of what OSHA is thinking about and considering as it evaluates either an incident inspection or your safety program on a work site. And a lot of these other elements are just ways that you can think about controlling the flow of information, minimizing business disruption. It can be extremely disruptive when OSHA is on site for an inspection. People are anxious. People don't want to be worried. Some of your subcontractors are probably just going to pick up and leave. And it can really disrupt the flow of work at the workplace. So we'll talk about some tips and strategies for how to manage that and how to use that potential for business disruption to control the flow of information to OSHA. Thinking about casting your workplace in the best light, your workplace and your safety program, and then identifying potential problems early, especially if you can, before OSHA does, and fixing them, or if not, at least early in the inspection process and addressing them to perhaps circumvent a citation or at least be in the best position to defend one. The first place that I look to for the tools for how I can influence an OSHA inspection is the OSHA Act itself. And Section 8A is the most useful tool available to employers for OSHA inspections. And that is the provision that gives OSHA the authority to inspect, but also puts limits on the inspection. It says that OSHA may inspect at reasonable times any workplace during regular working hours and at other reasonable times within such reasonable limits and in a reasonable manner. And you get the emphasis there on reasonableness. OSHA has to be reasonable in how it conducts its inspection. That means a reasonable scope of documents that it's requesting, reasonable time to conduct employee interviews, a reasonable number of interviews, reasonable demands on the employer who's running an active workplace. And you can use that requirement that OSHA be reasonable to push back on certain aspects of OSHA's demands during an inspection. And so we'll talk about what those demands might be. And the first place to understand that is understanding OSHA's inspection rights. OSHA has the right to inspect workplaces with probable cause, administrative probable cause, or with an employer's consent, or where a hazard is identified in plain view. OSHA is not required to, and in fact is prohibited from giving advance notice of inspections that it performs. And they have the right during inspections to collect records, documents, physical evidence, and to conduct interviews. Those three final rights there kind of roll up under OSHA's subpoena authority. They can compel you to hand over documents, compel you to either make available for inspection or to literally hand over physical evidence or to conduct interviews of non-supervisory and supervisory employees. Employees have inspection rights during an OSHA inspection. They have a right to file a complaint, protected right to file a complaint that would trigger an inspection, and the right not to be discriminated or retaliated against for filing a complaint, for participating in an inspection, for anything they say during an interview with OSHA, or for exercising lots of other protected safety rights. And they have participation rights. It's not all employees, but an employee representative has a right to participate in opening conferences, walk around inspections. Employees have a right to participate in private interviews with OSHA. Non-supervisory employees have that right to participate in closing conferences and settlement conferences and things like that. So pretty broad rights of your employees during these inspections. And it may not feel like it during an inspection, but employers have inspection rights also. As we talked about, you have a right to a reasonable inspection at reasonable times. You have a right to demand an inspection warrant if you don't believe that OSHA is there on a legitimate basis, or that they're attempting to do a broader scope inspection than they ought to be allowed to do based on the circumstances. And you've got a right to demand a warrant and challenge that warrant if you think OSHA is wrong about that. We don't do it often, and I don't encourage doing it often, but there are some circumstances where it may be appropriate. You've got a right to an opening conference, and that's really important. We're going to talk about the opening conference. To me, is maybe hand in hand with interviews, the most important part of an OSHA inspection, but you've got a right to have one, and you've got a right to take your time and ask lots of really important questions and make sure that you're comfortable with the scope of the inspection and whether the inspection should proceed at all and how OSHA is going to conduct the inspection before they actually get out there and start walking around and performing inspection activities. And that might be a pretty good opportunity to control the flow of information to OSHA if during a lengthy and thoughtful opening conference with lots of questions and discussions, perhaps things are, a final audit is happening out in the field before the inspector walks around the workplace. Make sure that employees are following procedures and protocols and that low-hanging fruit is addressed. Well, a good long opening conference can help ensure that that's happening. You have a right to access a copy of an employee complaint if the complaint is what has triggered the inspection. And I think that's a really important right, because it's not unusual for OSHA to get an employee complaint about a discrete, narrow little issue in a discrete, narrow area of the workplace, and OSHA show up and try to do some big wall-to-wall inspection or a broader inspection than at least is covered by the employee complaint. And I don't think that would be appropriate. And so you've got a right to ask for that complaint review it and say, you know what, let's use this complaint to define the scope of the inspection and negotiate with OSHA to narrow the scope if they're trying to go beyond that. So make sure you're getting a copy of that complaint for that purpose. You've got a right to protect trade secret and confidential business information, not to withhold it from OSHA, but to protect it from OSHA's disclosing it to the public. And you'll want to take steps during the inspection to signal to OSHA what information you're sharing with them that you want to be protected from the public, from public disclosure. You've got a right to accompany the compliance, safety, and health officer at all times during the inspection. The only sort of exemption or carve out for that is the non-supervisory employee private interview. You may be required to step away so that they can proceed with a private interview. But other than that, you are escorting the compliance officer at all times, seeing everything they see, and to the extent you can, leading them as opposed to being led by them during the inspection.
Eric, can I ask a question there,
Yeah.
sort of in light of our history together with the matter we're dealing with? Does counsel have a right to be present when there is a non-supervisory employee being questioned?
Yes, 100%.
Okay.
So that's, in fact, I'm gonna skip ahead to that question because that is, probably the most important issue in the context of an OSHA inspection is interviews, and in particular, supervisory employee interviews. As a general rule, we try to do everything we can to arrange interviews in advance. We try to negotiate that during the opening conference, that OSHA will come to us with specific interview requests, that we will coordinate it, and we will arrange for those employees to be made available for an interview. And we try to use the reasonableness requirement to do that. That we've got employees who are working hand in hand and in coordination on a complex construction project, and just yanking employees willy-nilly out of the field to do an interview will be a significant disruption to the workplace. So tell us, OSHA, who you want to interview, and we will coordinate that and bring that employee to be interviewed by you. Think about in advance where you want the interviews to occur and to not occur in places where there is potentially a hazard in plain view or some documents that OSHA might be very interested in looking at. So sort of a sanitized, conference room or office in a trailer or something like that. We try to eliminate the, interviews that happen out in the field. I apply a 5-minute rule. It's not unusual for OSHA to do a stop and talk while they're doing a walk around, and they can do a little bit of that. But once it starts to feel more like an interview than a stop and talk, we'll try to step in and say, look, I know you got a right to interview this employee, but right now he's doing some important work. Can we schedule this for later today or tomorrow and get it set up for a proper interview like we talked about during the opening conference? So think about that. We try to, kind of push our limits as much as we can up to the point where we don't, push OSHA to get subpoenas. So we'll exert as much control over the process we can, but if it feels like OSHA might be heading that way, we try to avoid that because we like the flexibility of voluntary interviews over subpoenas. Non-supervisory interviews is a really interesting issue. This is a fight that we had. It's like Groundhog Day, a fight that we have with OSHA over and over again. Employees have a right, non-supervisory employees have a right to speak privately with OSHA. OSHA has co-opted that right. OSHA will act like and will say and will talk like and will execute its inspection with the belief that that right belongs to OSHA and not to the employee. And OSHA will say, it's my right, the inspector believes it's his right to talk privately with a non-supervisory employee. But the reality is, if a non-supervisory employee wishes to have a management representative or even the company's lawyer participate in the interview with him, that's the employee's right, not OSHA's right. It usually creates a big fight and often makes things, in reality, makes things worse. So I will do it sparingly. I will try to encourage employees to take the opportunity to meet privately with OSHA, unless I'm in dealing with a fatality inspection, where OSHA is not going to cut you any slack anyway. And so it's best to just, make sure you're protecting your rights as much as possible. So if the employee wants us in there with no coercion, no intimidation, no suggestion by us that they should do that, but they want a management representative, they can have that, including company counsel. If you're going to do that for non-supervisory employees, we have and we use a choice of representative form because there's a potential conflict of interest there. And so you want to make sure that the employee and the company waive that potential conflict to use the same representative in the interview. So that's the non-supervisory employee interview. But for supervisory employee interviews, the reality is it is not OSHA's right, and it is not even the employee's right, not even the supervisor's right to have a private interview with OSHA. The company has a right to be present under the OSHA Act, has a right to be present when evidence is taken from the company. And supervisors, and I'm using the word supervisor here purposefully, not manager. Manager has a lot of meaning in under a lot of different labor laws and statutes. OSHA uses supervisor, and a supervisor is anybody who supervises and assigns activities to another employee. So it can be a low-level supervisor that has no hiring and firing authority, no discipline authority, but any employee who supervises the work of another employee be considered a supervisor, and that individual's knowledge and statements are imputed to the employer. And because their statements are imputed to the employer, like the company itself is sitting in the chair answering questions, the company has a right to be present and to participate in those interviews. And I encourage that in all circumstances. Anytime you have a management representative, a supervisor being interviewed, there should be somebody in there with them. In-house counsel, one of us, even just another co-manager, right? If it's the construction manager in with the assistant construction manager, have that other person there to make sure that the witness isn't being pushed over, to make sure that there's not big misunderstandings about what's being said by either OSHA or the witness during the interview. A really important aspect there. And I also would say I don't ever allow a stop and talk style interview with a supervisory employee. Those should all be arranged in advance, and they should all be done after an opportunity to prepare the witness for an interview with the compliance officer. And here's, Wendy, you sat in with me on a witness interview prep session. This is my general approach to how I prepare witnesses, non-supervisory and supervisory witnesses for an OSHA interview. Explain rights, give tips, and so we've got rights on the left side of those check marks. I've got interview tips and strategies on the right side. But the last bullet or the last bubble is one that a lot of people just don't do, right? There's this worry that, am I coaching a witness if I talk about substantive issues? And that's just, it's perfectly acceptable to do that, not to coach so much as it is to, prepare them for what they're likely to be asked about, right? We've had a fall incident. We know that's why OSHA's there. Let's go through our fall protection program. Let's pull out training records that this employee signed and remind them about the training they received. Remind them what our requirements are. Remind them about the circumstances that would be relevant to the interview. There is nothing wrong with reminding employees about facts and knowledge that they have once had in their heads. It's, obviously you don't want to tell them something they didn't know before and instruct them to answer certain ways, but preparing them and reminding them about substantive issues is perfectly acceptable and something that you should be doing. And that's a good list there. Let me see if I can.
Eric, can I ask a question about is there guidance on what is considered supervisory? Because other than the bottom row, right, like everybody above is supervising to some extent.
Right. Yeah. So there's guidance, there's cases, there's case law out there about that. Essentially the standard is someone who supervises the work activities of another employee. And if you look at the cases and some of the guidance that's out there, it talks about things like giving assignments, instructing in like the means and methods for how to perform the task, things like that would be the important factors. It's not the factors that we're all sort of more familiar with in determining whether someone's a manager, right? Whether they provide the tools for the work, whether they can hire and fire and discipline and all that stuff. It's a much lower level than that. One of the things that I really like to do in those circumstances is to say to OSHA that it is to not admit that someone is a supervisor, but to say that, you know, we anticipate that you, OSHA, may try to treat this individual as a supervisory employee. So I'm going to participate in this interview because we think you may try to treat this employee as a supervisor. If you'd like, OSHA, to ask some questions about whether this individual is a supervisor and then commit to me that you will not treat him as a supervisor, I'll leave the interview at that point. But if you won't make that commitment and that you may treat this person as a supervisor, I'm going to participate. Then, you know, that way you either get them to buy in that the person's not a supervisor, which is great because they, you know, their statements won't be imputed to the company, or you might be able to sit in on some interviews that you could later argue was a non-supervisor. That's one strategy to think about.
Eric, again, the way we work a lot, and maybe kind of when he's talking about is in the field, again, it's back to that supervisor is a site supervisor, but in the day and age that we're in now, rarely do we have more than one or two people that are actually total employees on site. So it's more of a supervisory over those subcontractors. So I'm assuming the same rules apply though, as far as, you know, they usually call Bill Myers or myself, one of the safety guys, get us on the line. You know, we listen in, help in, or attend if we're in the area.
Yep, that's exactly right. So just, you know, with a couple of minutes, and I know we're basically at 4:30 now, so if folks have to drop off, it won't hurt my feelings, but I'm happy to go on for a little bit longer to try and get through a couple of these stages if folks want to continue the discussion as well. But, you know, very briefly, these are the major stages of an OSHA inspection: opening conference, document production, the walk-around inspection, employee interviews, and a closing conference. And I do want to at least spend some time talking about the opening conference, because as I mentioned earlier, that with employee interviews, I think are the most important stages of the inspection. And the opening conference is really critical because it's the last chance you have to maybe avoid an inspection entirely. And it's the last chance you have to really narrow the scope of the inspection. So when an opening conference occurs, the compliance officer shows up, displays their credentials. I'm here from OSHA. I'm here to conduct an inspection. You know, think about in advance, where am I going to hold an opening conference when that happens? Understand that the compliance officer wants to immediately get out into the field because they know that things start changing as soon as people become aware that a compliance officer is on site. And, you know, we sort of have the exact opposite objective. We want to take as much time as possible during an opening conference so that things can change and so that things can be communicated so that everyone is prepared for the visit from OSHA when they start to do the walk-around inspection. So during the opening conference, you know, think about going to, you know, a trailer, an office in a trailer, somewhere outside the fence line, wherever makes the most sense, and sit down and have a thoughtful discussion. Think about who should participate in that meeting. If it's somebody who is not present at the site, like a regional or your corporate-wide safety leadership should participate in that discussion. If it's a major incident inspection, maybe it's your counsel, in-house or outside counsel, you want to participate in that. And if the meeting has to wait until those people can be present or available to participate, so be it. And maybe that's a good thing. And you know, OSHA has guidance out there that says they will wait a reasonable amount of time for the company's representatives to be present or to participate in an inspection. And that includes for the opening conference. So if there are particular people who are not present at the site who you want to participate in the opening conference or in any stage of the inspection, you can ask OSHA to wait. They will generally wait at least 2 hours. That's in their mind, 2 hours is reasonable. To me, reasonable is reasonable. And whatever that means, if it's somebody who is, for non-surreptitious reasons is unavailable, but will be available in 3 hours or 4 hours or the next morning, don't be afraid to ask for them to wait for that to occur, because the alternative is they've got to go and get a warrant, and that's going to take several days. So use that potential leverage to make sure that they wait for your chosen representative. During the opening conference, the compliance officer is supposed to explain the purpose of the inspection, what initiated the inspection, and what the intended scope is going to be. I'm here because of an employee complaint about an unsafe forklift operating at the site. All right, so now we know that it's an employee complaint. We're going to ask for a copy of the complaint, and we're going to try to make sure that the compliance officer limits the inspection to just that forklift or forklift issues generally. You may start to get some documented information requests from OSHA during the opening conference, and you might want to, during that stage, you want to resolve the warrant issue, whether you're going to demand a warrant, and you're making that decision at the end after you've had the discussion about whether OSHA is going to abide by a reasonable scope, that you've been able to negotiate some reasonable ground rules. And what are some of those reasonable ground rules? Think about the document production strategy. One of the major rules, this is something that I require in every inspection, is that OSHA give you their requests in writing. And I try to make sure that they know I'm not asking for a subpoena. I'm not asking for anything formal. I just want you to put your requests in writing. You can write it down on a paper towel if you want. You can email it to me if you want. But that's going to be the best way to make sure we understand what you're asking for and that we get you everything we need. It's also a great way to narrow what they ask for. I can't tell you how many times I've been on a walk around inspection with a compliance officer who's just rattling things off left and right. Oh, I didn't realize you had cranes on this site. I'd like your crane safety program and all the maintenance records for that crane. Oh, well, look at this. You've got an excavation. I didn't know that was going to be the case. I'd like soil sample information and training information for your competent person on excavations. Oh, I didn't realize you had that. And they ask for a million things. And I just say, yeah, sure, anything you need, just put it in writing and we'll get you what you need. And at the end of that inspection, the next day, he emails you a request that includes about 5% of the things that he rattled off as he was walking around the site. And I'm only going to respond to those items that are in writing. Also, when they come in writing, you get to parse the words a little bit, give a little thought to what exactly he's asking for, and respond in a thoughtful way to the written request, rather than trying to interpret something that was shared verbally with you. So insist on written requests for documents. Insist on coordination of interviews, right? And talk about how, look, this is a complex and dynamic work environment. Construction sites are like that. And pulling any employee off of their job tasks is going to create real disruption. So please, all we're asking is that you let us know who you want to talk to and let us coordinate a time when it is safe to have the employee stop what he's doing and come visit with you. We're not going to play games with you. We just want to make sure that we're operating safely here. Generally, they'll do that. If it is going to be a multi-day inspection, I try to arrange during the opening conference to have a daily closeout meeting to gather as much information as you can from the compliance officer about the inspection as it's going along. Any issues you've identified so far? What do you think you're going to want to do tomorrow? What do you think you're going to want to see? Who do you think you're going to want to talk to? Gather as much as you can to help prepare for the next, the next stages of the inspection. We talked about document production. Insist that they be in writing. Try to avoid subpoena if you can. You don't have to create new documents. Sometimes it's beneficial to do that. But one of the things I'm seeing these days more than ever before is OSHA issuing what is essentially interrogatories rather than document requests. And they're just not allowed to do that. They don't have subpoena authority to compel you to create records or to create answers to interrogatory questions during an inspection. What they can do is subpoena documents and ask you voluntarily for documents that already exist. So sometimes we will respond to interrogatory style questions with, we're not aware of a document that exists that addresses those questions, and leave it at that. Or if it's a strategic reason to answer the question, we'll answer the question. And other times we'll provide a document with a cover letter that has a narrative explanation, sort of giving context that we think is helpful and context that will cast that record and our overall program in the best possible light. Try not to volunteer information. Don't try to project or forecast where they're going and what they might like to see and what they might want to ask for. Make them ask the question, provide only what they ask for. It's not going to ever prevent you from introducing new documents or new evidence later in the process if you need to. But, you know, I look at every document as, you know, sort of a target at the shooting range, more for them to shoot at, more for them to poke holes in. So, you know, don't, you know, try to make your proactive case. Sit back, find out where they're going, what they need, what they ask for, and save the defense for when there's something to defend. And then before you produce documents, review them and think and look for, is it responsive? Is there a potential privilege claim over this? Often the case for investigation reports and audits and things like that. Or are there red flags that are important for you to know about that you might have to explain or to give context to before you produce it? And of course, if it is something that you don't want the media to see, a plaintiff's attorney to see, or one of your competitors to see, label it as confidential business information. And it may be withheld from disclosure to the public, or at least you'll get a heads up that somebody has asked for it from the agency. Keep track of everything you share with OSHA. That's going to be really helpful to me if I'm stepping in to defend citations, because it's fairly deep into the process with OSHA before you get a copy of the inspection file. So it's really useful to have a duplicate set of every document you share with the agency and a log that tracks what they asked for, when you gave it to them, and what you gave would be very helpful. The walk-around inspection, really important part of the inspection. This is where the compliance officer gets out in the field, takes notes, takes photographs, takes video of the actual physical conditions in the workplace. You should control the scope of that walk-around inspection based on the scope of the overall inspection that you talked about with the compliance officer during the opening conference. And that means, you know, if it is just an issue with one location in one structure in a big community that's being built, think about how do we get to that one structure in the, you know, least sensitive route, the route that takes us by the fewest of, you know, the least amount of active construction work, that goes by, you know, that doesn't go by, you know, trenches and excavations and all sorts of stuff like that. And then even think about, and I've done this before at manufacturing sites, where OSHA's complaint is about a particular piece of equipment, bring the equipment up front to the parking lot where the compliance officer is, so they can look at the forklift, or they can look at the welding equipment, they can look at whatever it is that the complaint is about without even setting foot on the construction site. You know, again, think about the scope of the inspection and try to control where the person goes, where the compliance officer goes, how they get there, or whether they need to go on the site at all. Remember that you've got that right to be present and to accompany them. To me, it's not accompanying, it's escorting. You control how they go, how they get there, to the extent you can. Take side-by-side photographs. If OSHA is taking a photograph of something, you should take that side-by-side picture. And one of the things that I love to do now that is remarkably effective is to ask the compliance officer, hey, look, I'm supposed to take a side-by-side picture. Can you tell me what you just took a picture of and why? They don't have to answer that question, but sometimes they do. And sometimes you learn really interesting information about something he thinks is a violation that you might be able to explain away right there on the spot, nip it in the bud before it gets there. Act professionally, act, you know, cooperatively and courteously, but protect your rights. You know, don't let them lead you. Don't let them expand the scope of the inspection when it's not justified. And you know, be courteous, but assert those rights as necessary. If the compliance officer identifies something that is a hazardous condition or a potential violation, it is a good idea to respond and react to that and address it, but do not admit that it is a violation. You know, say thanks for noting that. We'll jump right on that and address that. And if you can do it in front of them and show them that you've done it, that's a great thing. Sometimes they'll do you a favor and not write the citation if you fixed it right there on the spot. It's still a violation, even if you fix it right away. But sometimes they won't cite you if you act quickly about it. But you want to make sure you don't admit that you knew about it. You want to make sure you don't admit that it is in fact a violation of a rule. Just thank them for pointing it out and address it if you can. And of course, make sure that you require the compliance officer to follow all your rules. If he's going to be, you know, going to an elevated a location to observe something at heights, Make sure that he's following your fall protection requirements. Make sure that he's wearing the PPE that you require anybody else to wear on site. If you require visitors and guests on the site to go through some site-specific training program, make sure that the compliance officer goes through that training program as well. A, you want to show that you always enforce your rules, and B, you want to, the worst thing in the world that could happen is the compliance officer gets hurt during an inspection at one of your sites. You're going to be in big trouble. And it's going to potentially buy you more time or keep the employee and the co-show out of an area that you don't want them to go in. If respiratory protection is required to go into a certain location and the co-show doesn't have that respiratory protection, you don't have to provide protection for them, and you should enforce the requirement. And so they've got to come back another time or just not go to that location at all. I think we talked about all of this. If there's going to be sampling that OSHA wants to perform, noise monitoring, monitoring for potential chemicals that employees might be exposed to during welding or other construction activities, don't let that proceed without an opportunity to do side-by-side industrial hygiene monitoring. So say to OSHA, sorry, that we're not going to be able to proceed with noise monitoring today because we've got to get our own industrial hygienist out here to do side-by-side monitoring. Let's coordinate that. Let's arrange that at a time that we can have a hygienist present. And that gives you an opportunity to prepare for that monitoring activity. The same for any kind of sampling they might ask to do. You've got a right to be present when evidence is being taken and to do that sort of side-by-side evaluation of the evidence. And that would be true of, soil samples, noise monitoring, et cetera. And that's an important thing to exercise that right if you can. We talked about interviews already, and I think that gets us to the closing conference. The closing conference, unlike the opening, to me, while it is very interesting and we've all been sitting on the edge of our seat waiting for it, is the least important stage of the OSHA inspection. It is not a time to try to negotiate with OSHA. It's really just a time to listen, to hear what direction the agency is headed. There are some important things that you can do during the closing conference. If there is an obvious error that the compliance officer has, you can try to correct that. But if it gets into the point of a back and forth and a debate and a negotiation, just stop and take it up at another time. But if they say, look, we're citing you for not training your employee in fall protection, and you say, well, wait a second, we absolutely provided fall protection training to our employee. You never asked for the training records. I could get those for you this afternoon if that can, nip this one in the bud. So look for those obvious errors, obvious misimpressions that can easily be corrected. But anything that's sort of a judgment call, an interpretation dispute, things like that, just take notes, ask questions, and wait for the next step in the process. And don't offer any commitments. Don't make any admissions, but ask lots of questions to the extent you want. Try to understand who they think was exposed, why they think it's a violation, specifically what standards were cited or are going to be cited. You can ask about classification. Is it going to be willful? Is it going to be repeat? Usually they won't answer those kinds of questions. What's the penalty going to be? Usually they won't answer those kinds of questions, but you can ask and try to get as much information as you can. If for no other reason, to prepare for the potential of a press release. OSHA issues these nasty enforcement press releases, and they do that in significant cases. So try to read the tea leaves, try to ask some questions to figure out whether that's likely to occur so that you can prepare maybe your own press statement to combat those negative press releases. So I think that is it. Yes, we've gotten to the end in only 16 minutes over the allotted time. Does anybody have any questions about OSHA inspections? Is anybody still there? Yeah, I think you are. Well, I would suggest a couple of things as we close out here. We do have really terrific blogs. Our OSHA Defense Report, www.oshadefensereport.com. We work really, really hard to keep that updated and fresh. I'd love to know that someone other than my mother is reading it, so please check it out. You can subscribe to it so that you get an email with a link to new articles when they're posted. Right now, it's really like the COVID-19 defense report. It is, at least weekly, if not more often, articles about COVID-19 issues. Check that out. Lots of good stuff there. And then also, if you weren't bored to tears and annoyed terribly by my voice and my style of presentation, we do free monthly OSHA webinars on different topics every month. Here's what we've got going on in 2020. I'd encourage you to sign up for those. If you sign up and you can't attend, that's fine. You're going to get an email with a link to a recording and a copy of the slides each month. But really interesting stuff we cover there in programs just like today. And if there are topics that you think would be important and interesting to cover in this program, please let us know that too. This is really a client-driven program that we put on. So check those out. And of course, reach out to me anytime.
All right. Hey, hi, Eric. This is Tim. Thank you very much. This has been really terrific. I tried to pipe up earlier, but I didn't know how to get unmuted. But I do have a COVID related question.
Great.
The CDC recommends that you require employees, when you have a positive case, that any employees who are in close proximity to the positive case be quarantined as well. At least that's how I understand it. And for close proximity, they use, I think it's 10 minutes within 15 feet, or if I got that right?
Yeah, 6 feet for 10 to 15 minutes or more.
That's right. 6 feet for 10 to 15 minutes. Is OSHA observing that as well?
So yes, I mean, basically CDC and OSHA should be viewed as kind of hand in hand for all of these recommendations. I will say this though, that there is a nuance that CDC has introduced. It was, one of the modifications to earlier guidance, that they now say for someone who is a potential COVID-19 case, in other words, somebody who's not tested positive, who's not showing symptoms, but who had that kind of close contact, they don't necessarily have to be quarantined. They don't necessarily have to be sent home from work. If they're asymptomatic and you can take other steps to isolate them and protect them or have others protected from them while they wait for a test result, or if no test result if they're not being tested for whatever reason, as long as they remain asymptomatic and they are not a confirmed case, and there are ways that you can isolate them still at work, they are permitted to stay at work and not required to take the 14-day, quarantine. But by and large, yes, FedOSHA is following that same kind of guidance, and the way they're following it is they're going to be looking for an exposure control plan that has elements like that. Like, what is your strategy for dealing with confirmed cases in the workplace? And does your strategy align with guidance from agencies like CDC, from state and local health departments and things like that? So if there are recommendations out there for what you should do when you have a confirmed case or a close contact case, that you have a policy or procedure that aligns with that. And it's not like these specification standards where if you've got one piece of the program that's missing, I don't think that is a de facto general duty violation. If you have, a program that generally aligns with the guidance, you're going to have really good defenses to a general duty clause violation. I think there are some big things that will stand out to OSHA, like face masks, like not enforcing social distancing where it's feasible, like not removing employees from the workplace who have tested positive, that may be on their own enough to be a violation. But that's how OSHA is going to evaluate things. They're going to look at the CDC guidance. They're going to look at their own guidance. They're going to look at health department guidance and say, are you implementing enough of this to protect employees in the workplace? And I think that's the general approach that OSHA is taking here.
Okay. All right. Well, listen, Eric, this was great. I learned a lot. I've always never been terribly comfortable in this space, and this was really terrific. So thank you very much.
My pleasure. And anytime anybody has any questions about kind of any OSHA related issue, I'm a huge nerd about this stuff. I love talking about it. So don't hesitate to reach out. And And I would just say, you know, as we close out, you know, thank you for the opportunity to partner with Toll Brothers. It's been we're early in the partnership, but you know, we're excited for the opportunity and for the, you know, interesting work that we've done with you guys already, and hope that it's a, you know, a long-term partnership. I appreciate it.
All right. Well, I hope it's long-term, but I hope it's infrequent.
But infrequent, that's right.
All right.
All right. Thanks, everybody.